I'm here with Bonny Specker, who is going to give us an update on the COVID-19 situation that has been happening in our region, across the state, in the nation, and in the world. And also today, she is going to talk to us about boosters and pediatric vaccines, as well as the FDA approval process and the data that they look at when they're going through that process. Bonny, what do you have for us today?
Thanks, Chelsea. Before I get into that, I just want to mention one thing because I've seen out on social media some concern that the vaccine isn't FDA approved. And I just want to remind people that the Pfizer vaccine actually was approved by the FDA in August. And it's for the use in people age 16 and older. This is a full FDA approval. It's not an emergency use authorization. But maybe what's confusing people is that once a drug has FDA approval, the company is actually allowed to start marketing it with an official name. And so the Pfizer vaccine's name is this Comirnaty, which I'm not sure even how to pronounce it. But I did see an article in the Smithsonian Magazine, and the link's here on the slide, that talks about how did they come up with that name. And it was kind of a fun article that people might be interested in. But moving on to the boosters, that the Moderna booster was approved last week. The Pfizer's been approved for a while, the third dose of that Pfizer. And I just thought I'd go through real quick who's eligible for those boosters. And right now it's people who have completed the initial series of either the Pfizer or the Moderna at least 6 months ago. And if you're 65 years of age or older, or if you're 18 and older and you either live in a long-term nursing care facility, you have some underlying medical condition, or you work and live in a high-risk setting. And it's interesting because probably the majority of South Dakotans are now eligible based on these criteria. You know, overweight is a high-risk medical condition according to the CDC and the data that's out there for COVID. So anyone that's overweight or obese, which is about 70% of the South Dakota population, is actually eligible. And then also people who work or live in high-risk settings, people and also high-demand type jobs. So agricultural workers, manufacturing workers, people that work in the grocery store, they're all eligible for the booster. As far as the Johnson & Johnson vaccine, you have to have been vaccinated at 2 or more months, not 6, and you have to be 18 years of age and older. And they also said that you can mix and match a booster. So if you got a Johnson & Johnson the first time, you could get a Moderna or a Pfizer booster. So you can mix and match these various vaccines. Moving on to the pediatric information, first, I just want to mention the dose for the Pfizer for those people that are 12 years of age or older. It is 30 micrograms of the mRNA 3 weeks apart. And what dose? They tested actually 3 different doses in the 5 to 12-year-olds, but what they are recommending is the lowest dose, this 10 micrograms per mRNA 3 weeks apart. So I think it was 10, 20, and 30 micrograms were the doses that they tested, but they did go with the lower dose. The FDA Advisory Committee recommended approval of this vaccine, the Pfizer one, a couple days ago for children aged 5 to 12 years of age. That doesn't mean that they're actually giving them yet. It still needs to go through CDC approval. But I thought it would be good to just talk a little bit about the data that where the data comes from that the FDA reviews. And before you get to, when you're developing a drug, before you get to the actual trials, you have many other steps before that in terms of drug development and initial testing. But ultimately, sort of the final step is where it goes into what we call a clinical trial. And almost all clinical trials that the FDA looks at are randomized, blinded, placebo-controlled trials, which is kind of a big description, a lot of adjectives there. And I thought I'd just talk a little bit about what each of those words mean and why is that important. So a randomized trial, the purpose of that is to make the groups that you're comparing as similar as possible. And what you do is you often do this blinded so that people don't know what group, it's random, the assignment to either the vaccine or a placebo. A placebo is just like, for the vaccine study, they would just get injected with a small amount of saline or salt water. It would have no effect, no health benefit, no risk. So it's just so that you have these groups that you don't know which group you're going to be assigned to if you agree to be in the study. Now, an example of why you do that, say you have this physician and they say, well, my patient's going to benefit the most from this vaccine because they have a lot of risk factors. It's really important that they get this vaccine. So they might put that person in the vaccine group rather than the control group. But that's going to cause a problem because now the groups are no longer comparable. If you have several people doing that, then you have in the vaccine treated group all of the people with risk factors. So the groups are not comparable in things other than, getting the actual vaccine. So you really want the groups to be as similar as possible at baseline, and randomization is the way to do that. And, there's books written on how do you randomize people, and there's a lot of different ways you can do it, but it is kind of a science in itself. The term blinded, what that means is that the person or the observer, either the observer or the participant in the trial, don't know what they received. So and most times both people are blinded. And that's important because you don't want bias going into the results. If I know someone got COVID, I may ask them my questions, or if they got the COVID vaccine, I may ask my questions of them just a little bit different than if I knew someone got a placebo. I might ask to them differently or ask them a little bit more that would lead to different conclusions. And here's sort of a blatant example. I doubt this would happen, but you could have someone who says, well, I think this vaccine really works, and I know you got the vaccine and not the placebo, so I'm sure you don't have COVID, and I'm not even going to test you for it. Whereas someone who was put in the placebo group is like, oh, I know you got the placebo, well, I'm definitely going to test you for COVID. So they could be treated differently. So you don't want the observer or the participant to know. And this could be done consciously, like the example I gave, or it could just be unconscious and, it's not as obvious. So placebo-controlled, the purpose there is to actually compare what's observed following the vaccine, both good and bad, to a group of people that didn't get the vaccine. And if you don't have this control group or placebo control, you don't know whether what your findings are a result of your intervention or your vaccine, or whether it just would have occurred anyway. So an example here is that in this particular study with the pediatric vaccine, 0.2% of the children who received that Pfizer vaccine developed COVID. If you didn't have a placebo group, you wouldn't know what that even means. maybe that's the percent of the unvaccinated children who would have developed COVID. So you need that control group. Another example is after receiving the first dose of the vaccine, 22% of the children had a headache. And you could say, oh, that's really a lot. You know, the vaccine has this big side effect of headache. And it could sound important, but if you have this control group that received the placebo, what you see is that 24% of the children who received the placebo also had a headache. So now you can compare the two groups a little bit easier. So what did the pediatric trial find? Well, one of the things they looked at was the immunogenicity and also the efficacy of the vaccine. And to look at the immune response, you know, they actually draw blood and they measure the antibodies at set times after the different doses. And they found that there was a really good immune response, especially after the second dose, and that the vaccine effectiveness was 90.7%. And after this, a week after that second dose. These are very similar to the findings that were seen in the adult studies. And this is a really high vaccine effectiveness. If you look at things like the flu vaccine, I think it's, you know, you're lucky if you can get it 60% effectiveness. So it would prevent symptomatic COVID in a large percent of the people who receive the vaccine. Again, it's not 100% effective, but it should do very well. One of the other things that they look at are different types of reactions. So they look at the safety of the vaccine. And I thought I would just briefly define what some of these terms are that they use. And all of these documents, actually, the link is here at the bottom. You can look at everything that was reviewed by the committee, their agenda, who participates on that committee, on that link there below. But some of the things they look at are what's called solicited, local, and systemic reactions. So local means at the site of the actual injection. Is there pain there? Was there redness? How long did it last? Did it stop you from doing your everyday activities? Those are the types of questions they ask. Systemic reactions are things that occur throughout your body. And that would be things like fever or fatigue. You know, it's not a local reaction at the site of the injection. It's more an overall body reaction. So they do ask standard battery of those questions. Then they have what's called unsolicited systemic reactions. And those are where they're not asking specifically about a headache or a fever or fatigue, but they're saying, what else, you know, did you have any other reaction? How did you feel? More of an open-ended question. And we'll come back to those in a second. And then they look at serious adverse events, and they have a data safety monitoring board that reviews all of these events, both adverse events and serious adverse events. And they have set up before the trial what they're going to consider as serious and adverse condition or events. And, you know, a lot of time is spent doing that. Now, the standardized medical queries, that we're going back to the unsolicited systemic reactions here, as well as the ones adverse events. What they do is they enter those, or they look them up in this like big dictionary that standardizes medical terminology, and it will give you back like systems, organ systems, that you could then see if there's clustering. For instance, headache would get categorized under neurological, right? Because it could be that, as well as a whole bunch of, you know, it'd be under brain, it'd be, could be under neuromuscular, I'm not sure. Or if you have like kidney stones, it'd be under, you know, renal, calcification, different terms. And then they can look at to see whether there are events that are clustering under certain categories? Are there a lot of renal effects that if you just looked at, or kidney effects, if you just looked at kidney stones, maybe you wouldn't see something, but if you included other kidney type diagnosis, you might see a clustering by organ, the kidney. So that's done as well. I've been involved in some of these, and it's kind of interesting to look at that data. So what did they actually find? And again, all of the findings for the safety results are on that link that's provided. They did find local and systemic reactions, and they found that they were more frequent after the second dose, and they were mild to moderate in severity and resolved after 1 to 2 days. Now, if you look at, say, any pain at injection site or fatigue, those things, how do you define mild, moderate, and severe? And I do know that severe would be something like, I couldn't go to work or I couldn't go to school because I was so tired. Okay, so that kind of gives you an idea of how they would say something was severe. If you look at what was solicited reactions, the things that they specifically asked about, the most commonly reported ones were pain at the injection site, which you would expect that on any vaccine. But you can see that the importance here, if we just look at this dose 1, of having that control group or the placebo. If you looked at 74%, you said, well, that's really high, but then look at the people who didn't really get anything. It's 31%. Same with fatigue. There's not a lot of difference here. And this is because people every day, some people have fatigue, right? People are tired. Every day, people might have a headache. And that's what you're seeing with these numbers. The big one following the first dose is pain at the injection site, but then fatigue and headache are really no different here. But if you go over here and look at the second dose after they got that second one, you do see a little bit more fatigue in the vaccinated group compared to the placebo, as well as headache. What I thought was interesting is that it isn't so much the headache increases here, but that it goes down in the placebo group. I just thought that was kind of interesting. So looking at unsolicited adverse events, these are ones that they didn't specifically ask about, but seem to be reported by people. There were some children that had swollen lymph nodes, following the vaccine. And I think this is true in the adult vaccine as well. And you had more people or more children that had hypersensitivity type adverse events, rash, mainly rash and some sort of dermatitis or skin rashes, than the placebo recipients. There was no anaphylaxis reported. And the serious adverse events occurred at a rate of less than 0.2% in the vaccine recipients, which was actually the same percent that occurred in the placebo group. And all of what were considered serious adverse events were considered unrelated to the vaccine, a spider bite. So these are things that are going to require medical attention. That's usually how serious adverse events are defined. So did you have to go to the doctor for some reason? That's going to be flagged as a serious adverse event. And in this case, there was a spider bite, there was a knee infection, and someone broke a bone. So those were the events that occurred during the trial, but they were completely unrelated to the vaccination. They also have, and again, this is a whole presentation that is on the website. They did a benefit risk analysis, and they found that the benefits outweigh the risk, and this is especially true in high-risk populations. So in areas of substantial or high community spread, and where other preventive measures are not being taken are considered high-risk groups, as well as children that may have medical conditions that put them at high risk for COVID. If you look at the benefit risk, if you're a normal, healthy child and you live in an area where the spread of COVID is low or none, then the benefit risk is not as great as if you have a higher risk scenario. Now, one of the things that the benefit risk analysis, and you can see on this website what they took into consideration in determining the benefit and the risk, is that it doesn't really consider the benefit of a child being vaccinated to protect other children, that whole idea of herd immunity. You know, there are immunocompromised children out there. There are children who cannot receive a vaccine, and you know, one child getting a vaccine, if you have enough of those children being vaccinated, it will protect that immunocompromised child. And the risk-benefit analysis did not incorporate that into it. So it didn't look at the benefit to society, it looked at the benefit to the individual child. As far as where it stands right now, as of today, Thursday morning, the CDC recommendations have not been out yet. So they are expected in the next week regarding the Pfizer pediatric vaccine. Now, moving on to the next topic, the mortality, the death data for South Dakota. This is in the weekly handout or weekly PowerPoint presentations that's on the city website. But I just want to note that it's been updated through August of 2021, this yellow line. These are the number of deaths each month in South Dakota by year. These different colored lines, each different color is a different year across the whole season. And it's since 2010. You can sort of see the variation from year to year, the range that we normally have. And you can see that last year, the 2020, we started exceeding, we had highest number of deaths starting it back in July of last year. And this really peaked in November and then dropped back down in December. And then here, this yellow line is now 2021. We still had quite a high number of deaths in January. February, it was still one of the highest. By March and April, we were kind of back down, still running probably above average. But here in July, we're now above what it's been looking like where we were in 2020. And same with August. So these two are on the high side. The data there, these data lag by quite a bit because of the delay in deaths, certifying deaths. But it'll be interesting to see what happens out here later in 2021. And the website, there's a lot of additional information on the CDC website about that. So this week, as far as the weekly summary, we've been looking pretty good the last couple weeks, and then this week we're starting to get back into an uptick. And you see that here where we were declining, and now Brookings is starting to come back up. And this increase is actually just in the last 2 days. If we forget Tuesday, what was on the dashboard Tuesday and Wednesday, we would have had a nice decline if it had just continued. But a big chunk of these cases, of these 51 cases, have been reported in the last 2 days. 18% of them were in less than 20-year-olds, 41% in that 20 to 39-year age group, 18 in the 40 to 59-year age group, and 23% in the 60 plus. So hopefully this is just a little fluke and that we will continue to go back down. The only thing I want to say about this is we did do we looked at some projections through the University of Washington, a couple weeks ago, and they had something looking like this and then going back up, in November. So we'll have to see whether or not that happens or whether we can get it to come back down. But we are still on a high community spread at the highest level. If you look at hospitalizations, Brookings only had one last week. Brookings Hospital, according to the dashboard yesterday, had 6 admissions, which is the most we've had in a very long time. One of those is in the ICU, but they must be from out of Brookings County, or there's some delay here in the numbers. The total deaths, we didn't have any deaths reported on the dashboard last week. If you look at the state, we're holding kind of steady at around 2,200 cases a week. It's not declining and just kind of holding steady at a fairly high rate. And the state, these percentages are pretty consistent. There's a little bit of fluctuation from week to week, but it pretty much stays a fourth in each age group there. If you look at the hospitalization data, the number currently hospitalized as of yesterday was 199, very similar to 200 the week before. We did have a drop in the number that are in the ICU from 53 to 45. We did have 72 new admissions last week compared to 100 the week before. So that has dropped. And this is reflecting the drop in the number in the ICU. If you look at who's been hospitalized, 3% of those were less than 20 years of age, 13% 20 to 39, 19% 40 to 59, and again, the majority in the 60-year and older age group at 65%. So this is kind of nice that it's come down, but we're still running at a high number of deaths per week. 26 deaths last week compared to 28 the week before. 24 of those 26 deaths were in 60 years of age and older. There was one in the 20 to 39 year age group and one in the 40 to 59 year age group. If you look at the country, it's having continuing this nice decline that we've been seeing for almost 2 months now. We're down to 501,000 cases being diagnosed per week, so it's still quite high. If you look at the deaths, we went up a little bit this past week, but pretty much running around 11,000 the last 2 weeks. Again, that's more than 1,000 deaths per day in the United States. The other thing about this number, we're now above the number of deaths that occurred during the Civil War, which, is always thought of as one of the most deadly events ever. This is now above that number. We've surpassed that. If you look at the number of confirmed cases globally, that's also holding steady at about 3 million per week. And the number of deaths has declined a little bit. Last week it had like a little bump up, and this week it's back kind of in line. If you were to draw a straight line, hopefully this keeps going. We're at about 50,000, roughly 46 to 50,000 deaths per day or per week globally. So as always, take care of yourself and each other, and we'll get through this. So
Thank you so much for the update, Bonnie. I will see you again in a couple weeks.
thanks, Chelsea.